I'd like to start by introducing Emily Ward. She is the Associate Chief Nurse Executive, and she works to ensure continued progress on initiatives and effective day-to-day clinic and inpatient operations. Emily is going to serve as our moderator today. So Emily, take it away.
Thanks, Tony. Can you guys hear me okay? Great. So I'm honored to be here and to talk with three fabulous nurses who I have worked with, two of them for quite some time, one just recently in the last couple of years, but I'd like to introduce them to you now. The first is Seth Jackson. Seth is a medical intensive care unit nurse, but he also works extra hours as a member of our ECMO team. This is the team that puts patients on heart and lung life support. And he also works for our special isolation unit, so he wears many, many hats. For his first 3 years at UIHC, he helped MICU nurses understand the importance of frequent skin assessments to prevent pressure injuries in our patients. Since then, he's become a leader in evidence-based practice, mentoring other nurses that are doing projects and helping them to navigate those projects to improve patient care here at UIHC. The second nurse, Nick Klein. Nick's also a nurse in our medical intensive care unit. He's been a nurse for 6 years. He started his nursing career in Des Moines in a critical care unit, and he spent the last 3 here at UIHC. We're incredibly lucky to have him. Nick is one of our recent DAISY Award winners. He recently had an experience with a patient that really highlighted how patients' lives impact nurses and how nurses impact patient lives. So kudos to Seth and Nick for being MICU nurses and really being on the front lines of inpatient care during this pandemic here at UIHC. The third nurse that I would like to introduce is Debbie Herold. Debbie's a longtime friend. We've worked together for a long time. Debbie's currently the Associate Director of Nursing for our community clinics, and she helps to lead the testing that we do for COVID. So we're testing about up to 1,400 patients per day through our drive-through testing options, and then about 100 in our clinics. And so Debbie is kind of, the working brains behind all of that. She's also helped get our vaccination clinics up and going. So, certain days of the week, we're vaccinating anywhere from 1,000 to 2,000 patients a day. And a big kudos to Debbie and to her team for the work that they've done for that. So welcome, team. And I think we'll get started with our questions. So first question for you all is, where are you from and why did you come to Iowa? Why are you here? Let's start with Debbie.
Yeah. Hi, guys. I was actually born and raised in Cedar Rapids, so a lifer in Iowa. I went to college in University of Nebraska-Omaha for undergrad and ended up coming back. So like all of you guys, I'm sure you chose Iowa for the weather. I was joking, but I actually came back to Iowa because I love Iowa. I love the people. And I think it was actually evident going through the pandemic, just how nice people were. And that was why I chose Iowa.
Thanks, Debbie. How about you, Nick?
I'm actually from Clear Lake, Iowa. And I came down here and went to school at University of Iowa. Didn't graduate with a nursing degree, found that career path later, but eventually came back to Iowa after getting my feet wet in the nursing world and wanting to work at the University of Iowa just because of its basically reputation. So
thanks. And how about you, Seth?
I'm originally from Iowa. I grew up in Council Bluffs, Iowa. I did my undergraduate here. I got a bachelor's in Spanish. Like Nick, I was late to find nursing, but Iowa did help me find that through my time working with guest services at the University of Iowa Hospital, helping park cars and take people to appointments, and then also being involved with the University of Iowa Dance Marathon. All those things combined helped me find nursing, and once I got my degree, I came running back.
Thank you. So to elaborate on that a little bit, what's your favorite memory at Iowa? Let's start with you, Seth.
Oh gosh, favorite memory, there's so many. I mean, I guess I have to go with Dance Marathon, though. I mean, that's how I met my wife. I was just amazing times with the best of friends, lifelong friends. So definitely Dance Marathon.
How about you, Nick?
I would have to echo Seth's. That's actually how I met Seth originally, was Dance Marathon. And But also I would say having my Iowa career be when Ricky Stanzi was the quarterback. That was real fun and awesome to watch all of that. So.
Thank you. How about you, Debbie? And it better include a memory with me.
Well, how do you go wrong with football? First of all, I'm a huge sports fan, and so Big Ten sports and just Iowa football. But I mean, yeah, the University of Iowa in nursing started 11 years ago, Emily, and forming those bonds, which is one beautiful thing about the U is that I feel like this is the only place to work in the state, and so you do foster those relationships throughout your entire professional career. So, yeah.
Thank you. So let's talk next a little bit about your guys' nursing career. What initially inspired you to be a nurse? Let's start with you, Nick.
I always knew that I wanted to do something with healthcare. I had an interest in science and also just the career path of helping people. So I was forever a pre-med college kid. And so I wanted to do that and came to Iowa pre-med and whatnot. And I actually had an advisor talk to me and tell me that I would probably be better suited for a nursing role. And I hadn't really actually thought of that. And then just kind of being more aware of it and observing it, I found nursing was actually probably where I should be. I like talking with people. I like just conversing and helping others. And so I eventually found the career path to nursing.
Great. How about you, Debbie?
Yeah, it's actually interesting. I also did not choose nursing first. My undergrad is in biology and chemistry, and went back later on. I was also pre-med. I knew I wanted to do something in the medical field. I did research in environmental toxicology for 2 years and realized that was not my lifelong dream. While it was fun micropipetting for a few hours, but so chose nursing. Similar to Nick, just because I really love people. I like talking to people. I like helping people, and honestly wouldn't change it. The nursing field is so diverse. You can do anything in nursing. You can be in informatics, finance, administration, leadership, teach. You can be at the bedside. You can I don't know. You can do anything in nursing. So I wouldn't change it for the world.
Thanks, Debbie. How about you, Seth?
I found nursing through my job in guest services. I knew I wanted to be in healthcare in some way, shape, or form. Like Nick, I was interested in maybe being a physician. For a short time, I was interested in sports medicine, so I did some things with that. And then when I found Dance Marathon, spending time volunteering at the hospital and hanging out with the pediatric hematology oncology population, I really found nursing through that. And so then I finally started taking my nursing classes. And like Debbie said, it was, once I finally found it, it was just a no-brainer. This is what I was meant to do. I love it so much. There are infinite avenues to take. You can do so many different things. Even just, I shouldn't say just, but even as a bedside nurse, you can have so many different patient populations that you can bop around for years and years and years and never see the full spectrum of the hospital. So that is why, I just love being a nurse so much and just working with the people.
Yeah. I definitely think because we have especially so many subspecialty populations here at the University of Iowa, you can even, changing the patient populations that you work with. There is just a whole breadth of opportunities for us and for, nurses that join our team. People ask me why I became a nurse. I tell them it's because my mom was a nurse, my aunts were nurses, my cousins were nurses, and it just, it seemed right. And I say my mom, for a long time tried to convince me not to be a nurse, but I got into it because she was a nurse and I saw the things that she did and the impacts that she made on people. But then I also tell people that now I stay here and I stay in nursing for a different reason. And it's because, me and my family and my son have received care here. I'm sure you guys and your families have received care here, and figuring out, how do we continue to do the best that we can do for all Iowans that get our care here. So I think, from you guys to every single nurse that touches our patients really impacts our lives. So thanks for sharing your stories. So tell us a little bit more about your specialty, like the area that you're working in. How did you get into the arena that you're currently working in, and tell us a little bit about it. Let's start with Seth.
So I am employed on the medical intensive care unit, and I got into the ICU during school. When I first started nursing school, I was gung-ho peds all the way. I was going to work in pediatrics, and I loved that so much until I got to my critical care semester of nursing school, and then that's when I found my love for the adult critical care population. And so when I came back and interviewing at the university, job availability at the medical ICU, and I took it. And yeah, I'm just so happy I did. I also am on the ECMO team, so I work with the heart and lung bypass pump for patients whose maybe their heart is really sick, or maybe their lungs, or maybe both. And you do that through neonates, pediatrics, and adults. And then with the EVP with the EVP group, helping to drive nursing change and make sure we're at the forefront of the latest and greatest in research and evidence.
Thanks, Seth. I just want to give a big kudos to Seth, the work that he has done with evidence-based practice and making sure that when it comes to skin care and skin breakdown prevention in our patients, especially our critical care patients who are at such a high risk, having people like you on the front lines that have such a passion for that type of thing is what really drives the excellent patient care that we're able to provide here. So thank you for being passionate, and thank you for ensuring that we're providing, evidence-based, scientific-based care for our patients. Debbie, let's go with you next.
Yeah, I've had quite the journey. So my role started in the ICU as actually surgical intensive care unit with Emily. I was a cardiothoracic nurse, and like Seth, really got into evidence-based practice and started digging into delirium screening changes and ventilation weaning protocols and the ABCDE bundle, and then got pregnant, to be honest, and knew that 12s and rotating nights and weekends wasn't a long-term plan in my life. And so while Emily begged me to be an A&M, I vowed that I would, that leadership wasn't for me at the time. And so went to the Accountable Care Organization, which is a family medicine-based program, really caring for patients through the care continuum, patients with complex chronic medical conditions. And so I did that for 2 years, and then was an educator in the Heart and Vascular Center, and then was again asked to be in leadership, and accepted it that time, and sort of fell in love with leadership and everything about leadership. I always thought I was passionate more about the quality and project improvements and evidence-based practice, but really did fall in love with leadership. And so spent about 3 to 4 years in the Heart and Vascular Center. And then 2.5 years ago came to community clinics. And now I oversee about 22 clinics across the state of Iowa. We house predominantly primary care, both in the adult and peds world, but also have every specialty that the University of Iowa has to offer. We're offering care in rural communities that is typically not available for those patients. So a really rewarding job. And so it's been a journey, but it's been fun.
Thanks, Deb. How about you, Nick?
I did my preceptorship through the respiratory specialty care unit, and the nurse that I had, she also rotated to the medical ICU at the University of Iowa. So I got kind of an exposure to ICU type of patients and had a real good internship. And so I found a job in Des Moines at a critical care unit that didn't specialize. So I got my eyes open to cardiac, surgical, medical, everything. So trauma. So I ended up staying there, loving it for a couple of years. And then I relocated with my partner back to here to Iowa, and had to do the ultimate decision of picking which specialty that I wanted to go to. So with a little consideration and pull from some friends in the medical ICU, I now work in the medical ICU at the University of Iowa. And yeah, I have been there for about 3 years and absolutely love it there. It's exactly my fit. I love the type of patient population. I love the variety as well, though, and it's my niche.
Awesome. Thanks, Nick. So let's shift gears a little bit and talk about COVID-19 and how it has rocked the healthcare world and your world as frontline nurses. Let's talk a little bit about what the immediate impacts. So let's go back, a year ago, those immediate impacts of COVID and what that had on your role as a nurse in our organization. And what did your day start to look like? How did it start to look different compared to non-COVID times? Debbie, let's start with you.
Yeah. The first word that comes to mind is fear. So my team, started running in February, what felt like a sprint. So Dr. Mborick, if you guys know her, she listened to a podcast from a provider in New York and really started expressing concern. And we made fun. It's just a little worse than the flu. Katie, it's fine, and she kept on holding the line. Like, no, I'm serious. We need to do something about this. So we met as a team and developed a plan. And the thing that I am most grateful for is Katie in that moment and listening to the podcast, right place, right time sort of thing. We, presented it to our CEO. They called a HICS before the even first case index even hit Iowa. We had a plan in place. We implemented telemedicine. We then developed the COVID clinic. We figured out how we were going to test. And so fear drove me in the beginning, and we sprinted. And then it was a waiting game. And there was a lot of anxiety, like, oh, you're in the COVID clinic. You can't come out of here. Don't cross this curtain, because nobody knew, the fear of the unknown sort of thing. So yeah, I would say that's probably, how it started. And then it was a waiting game all summer until the surge hit us, and we were, testing 1,400 patients a day. Luckily, right now it's a little lower, but always have to be prepared.
Yeah, and I think I want to give a shout out to not only Debbie and her team for the work that they did early on in figuring out how are we going to test people, creating those drive-throughs so that it was quick and it was easy and accessible for our patients. But our organization also created what we called a home treatment team. So as patients were being diagnosed with COVID, but were healthy enough to be home at that point in time, we were then hooking them up with our home treatment team. So physicians and nurses, we would send a blood pressure monitor as well as oxygen monitor to their house, along with a thermometer, so that they could keep track of their temperature, their blood pressure, their pulse, their oxygen levels. And then our team would call them every day or every other day and check in on them, ask them, what color's your urine? Make sure that they're getting hydrated enough, telling them how to do breathing exercises, telling them, how and when to be ambulating and those types of things. And all of that was an effort to keep them out of the hospital. And I think that we were on the front line of innovation when it came to that, because I honestly think that we did not see surges last spring because of our home treatment team. When other hospitals around Iowa were seeing their inpatient levels increase, we weren't. And I think it really was because we had so many patients enrolled with our home treatment team. But we did have patients that ended up needing to be cared for in our hospital. And I think that's where, we come to Seth and Nick, and the amazing care that they and their colleagues in the MICU and a few of our other units here at the hospital, your guys' life kind of shifted completely. You went from being a medical intensive care unit to being a COVID intensive care unit with maybe a few other patients. So Seth, tell us about kind of that immediate impact on you.
So with the immediate impact, I was actually out on paternity leave. My wife had given birth to our daughter. But the weeks leading up to that was still when we were housing our COVID patients in our special pathogens unit over in the surgical neurological ICU, and being in close communication with Natalie Grew, who is the nurse manager over there and the leader of our special pathogens unit. At that time, it was not decided to have multiple nurses be the caretakers for those patients, and it's just going to be a set few. So I didn't have the immediate impact as of yet. But then when I came back from my paternity time, it was full swing in the medical ICU. Almost 100% of our patients were all COVID-19 positive patients, and it was a real shock. Walking in and just seeing how we were arranging things. We would have our IVs outside the door with lots of extension tubing to get the medicines to the patients for our continuous sedation lines and our continuous blood pressure medicines. It was a real shock, and that was the first time when I was introduced to all of the special PPE of wearing my face shield and having all of that kind of thrown at me. It was a rough couple days to play catch up, and I would find myself, oh shoot, I didn't take my PPE off appropriately, wash my hands again, start over. It was a real steep learning curve for me.
Thank you. Nick, anything else you want to add?
Yeah, I kind of want to echo with those guys that the biggest thing that comes to mind was fear when it first started. I remember the special isolation unit being the designated spot for the first couple of patients that we had at the university. And then it switched over to our medical ICU, and we became the COVID ICU. And watching the patients stroll in, I remember it totally was a sense of fear. It was like, oh gosh, who has to take this patient? Like, we didn't have a small group of people that would take care of these. It was kind of everyone was going to have to take care of them. And I remember being in a report and being like, okay, we have 8 COVID patients now, like who should take care of them? And being like, well, I don't have kids, like stuff like that. I can take care of them for now, trying to like save the people that have kids at home, because we didn't know a lot about how does it spread, who can be affected, like how does it affect kids, stuff like that. So I remember just the beginning being so fearful about it. And I know we just referenced the other day at work, Seth, Monsters Inc., but it literally felt like that when you got home, that they scrub down when you get home to try to get as clean as you can, like just for fear that you didn't know how it spread or anything like that. So
Yeah,
it's definitely a time I'm glad we're past. So
yeah. I think too, I don't know about you guys, but I think one of the hardest things as an organization that evolved over the course of the last year was visitor restrictions. And I mean, that's hard, right? That's super hard for the patients. It's super hard for their families. And it's super hard for you all as frontline nurses, having to be the ones that are communicating, having to be the ones that are there, in last moments. And, I think we've made changes as we've learned more and we understand the virus more, and, being able to kind of switch things up. But that I think that's really rocked all of us to our core, because we're, patient and family centered. That's what we do. So that's the part that I'm most excited to get back to the normal of, is getting our patients, their families back with them while they're in the hospital. So the pandemic started about a year ago. We've been through this for a year now. I think a lot of us are feeling hopeful because the vaccine is here. And, a lot of healthcare workers are now vaccinated. We're starting to get people vaccinated in the clinic or in the community. I mean, talk to us about what things do you guys think are going to come out of this that are going to be good changes for healthcare? Debbie, we'll start with you.
Yeah, I have a few things. The first is telehealth. So, you mentioned that our goal was to keep patients out of the institution. Well, we did that. In the beginning, I remember the ED being like, we have 0 patients. Like, can we come help you? We've never had 0 patients. How did you do this? And so I think there's a place for telehealth moving forward. And it was nothing urgent, I think, nationally to sort of roll it out. And I think that patients enjoy it. And I think that's here to stay. I think from a University of Iowa perspective, what I have learned is the ability to work together across departments, across specialties, and to really move and make things happen. I mean, we popped up the COVID clinic in 24 hours. New Epic builds, new visit types. I mean, we can make things happen, and I hope that spirit, stays in the institution. Just knowing that really, the world is our oyster. Like we can do anything here. And I am excited about the future of the University of Iowa because of what we've went through in the last year.
Yeah, totally. How about you, Nick?
Yeah, I do like that most of America now has like better appreciation for like washing your hands and being more hygienically correct, I guess. And it is really nice to see, as someone who works in the medical ICU and sees flu patients every year. We, knock on wood, have yet to see a flu patient that I'm aware of. So the masks actually helped something, but it just kind of going forward, I was like, gosh, if everyone is vaccinated, I might still actually wear a mask during the winter just to protect myself from flu and whatnot. But as far as the university, it definitely has brought a new sense of appreciation to my coworkers, especially in the medical ICU. It's just like we went through a torture some days, like having to go through the beginning where like there were no visitors or anything, and having to watch patients pass away without their families present. It was traumatizing. And so having other coworkers that have been through that and kind of support each other has brought a new sense of appreciation for me towards everyone that I work with. So going forward, we just have that bond, whether we like it or not, being pandemic nurses. And so I really am grateful for that.
Thank you for sharing. Seth, how about you?
Yeah, I'd like to just reiterate what Debbie and Nick have said. I definitely foresee, great changes coming from this in the sense of transmission of, bacteria and viruses from person to person. I don't know if we will even really go back to maybe not even wearing like an N95 for a potential aerosolizing procedure. Like if there's someone in my ICU and we're going to intubate them, put on your N95. We don't know if maybe this patient has an active infection at that time, or maybe the swab is still at the lab being processed for if this patient has an active virus. So put on your PPE and just always protect yourself. And we were always very good with preventing transmission from patient to patient, and there were some outliers before, but I really think we can really drive that down. And just this has helped innovation as well. Just simple things from how we collect our labs and how we can do it in a way that I'm not going to be touching someone else or touching the bag that the lab is going to go in, and getting it to the lab safely, so no one there has to worry about, is this surface covered with potential infection. And how we arranged, like I said earlier, our ID lines, that was very innovative and brought to the forefront by seeing colleagues across the nation, and then talking with our colleagues in the medical ICU. We place these hooks on the ceiling where we can run the lines high up in the air until it gets to the patient, to help prevent it from touching other surfaces before it gets there, and preventing infection that way.
That's a really good example. Thanks for sharing. I think I was looking at my phone earlier today, and I saw an article from CNN pop across that talked about a nurse who was broke by COVID. And the article was about how she was a longtime ICU nurse, and she ended up quitting her job because all of this became just too much for her. And so talk to me about what has kept you going, through this last year. I think whether you're on the front lines or whether you're not, from having to homeschool your kids and do virtual learning to having to come to work and take care of these really sick patients with different workflows and different people and different PPE. It's a lot. It's a lot personally. It's a lot professionally. So tell me how you three are still here today, and, help me understand how we can do better to support our frontline nursing teams. Nick, let's start with you.
So let's see. Coping, I guess, has been a big part of this pandemic for me, especially like mental health. You're quarantined and not seeing everybody that's your usual support system, and like to give a simple hug means so much to someone, and that's been ripped away from a lot of us. So having to find different outlets and ways to actually talk about stuff has been a big thing for me. But like I said, I have a real close group of people that I talk to, that I work with, like share my thoughts and share my breakdowns and share my feelings and stuff. And that has honestly been my drive through the whole employment of being a pandemic nurse. I keep calling myself, but it's something to really highlight that it wasn't a coincidence. I think that 2020 was the year of the nurse. Like, it was a big year for us, and I still think that every year is a big year for nursing, but it was just highlighted even more. Like, the community definitely did a great job of coming forth and making sure that healthcare workers were taken care of and highlighted and appreciated. And that was overwhelming and cool to see as well. Like, there's never going to be a way for us to thank everybody, but it was just really neat to see the community come together for our unit. We had people bring in food for us or send us cards. We had a bunch of pictures from kids that drew photos of us being heroes and stuff. And it was just really neat to see that. So.
Yeah, I totally agree. The community came through in a big way. Even, the signs that people put out and, for us to say that we're all standing together, that's the way it really was, supporting one another and holding each other up. And I just saw today that the American Nursing Association is extending the Year of the Nurse into 2021. So we're going to get it for 2 years.
Great. You should.
Seth, how about you?
Like Nick said, the teamwork is something that's kept me going. I've had my ups and downs so much. I've been the teamwork in the medical intensive care unit was already, in my opinion, unparalleled, and it just got even better. I mean, there's no shortage of a helping hand of people wanting to do whatever is necessary to keep every patient safe and get them the best care possible. And they're my quarantine family. Leaning on them and talking about my times of stress and, crying with them and having our moments when we need to, and then strapping back up and going back in there to continue to give people the best care they deserve is what's been keeping me going. And I've utilized resources at the institution when I've felt pretty low. I've gotten in contact with our coping team to speak with people to help, to help work through my feelings. And that's been very beneficial. And all of our leadership's door is always open. My managers are always there. Our physicians are always there to speak with. People in different ICUs are there to listen to. And that's just what's helped to keep me going, is the teamwork and my quarantine crew with all my coworkers.
Thanks, Seth. How about you, Debbie?
Yeah, I'm very competitive. And so I felt like what kept me going was patience. Like, if not me, then who? If we don't figure this out, then who? And then I got to give a shout out to my team. I mean, my rocks, we called it the war room. I think we lived in Maine Hospital for like 3 months in a little old conference room. And they're my rocks. And you'll never see me break down in front of my peeps because I'm strong for them, but you have to have your moments. But, I don't know, just for the patients, really.
Thanks, Deb. I see a question actually a couple of questions in the chat have been, just around how do y'all handle this? How are you, managing your own mental health? And I think you guys have touched on that a little bit. Somebody specifically asked, what UIHC has provided in terms of mental health support. We have our normal pathways, our employee assistance program. Seth mentioned our COPE team. We also, there for a period of time when things were really rocky, we had a team from our psychiatry department that took calls 24/7 to a hotline that was available to our staff day or night, as people were really starting to process all this and work through it. So, and I think, like you guys have said, leaning on our teams, leaning on each other, and finding ways to support each other. So thank you guys for everything that you've done this last year. You're truly amazing. There is one question here. Somebody would like Nick to introduce his adorable dog.
This is my dog Biden.
Thanks, Nick.
Yep.
Here's a question that I'd like to ask you all. So what has been the most rewarding moment over the past year as being a nurse, and what's been the hardest? Debbie, let's start with you.
Yeah, the most rewarding actually just happened about a month ago when we got vaccine allocations and started vaccinating the community. You want to talk about coming full circle, and being in the trenches of ILI for the last year to now being able to give hope back to these patients. And I've never seen such excitement to come in to see a nurse or a provider before and get poked with a needle. I mean, like, people were cheering and clapping, and lots of great stories. And so that will always be a highlight in my entire career. Just the ability to give back hope. I think the hardest part was just there's still a lot of unknown. We're not over this yet. There's variants that are floating around, to be completely honest. We don't know how effective this vaccine will be and how long it'll be effective for. Just like the beginning of COVID, we didn't know if it was airborne or if it was droplet, and what PPE we should be utilizing. And so I think that's still scary, but I am confident in our team at the University of Iowa and in our expertise here. And if anybody can do it, I definitely think it'll be us.
Thanks, Debbie. I agree. I think, one of the hardest things also that's ongoing is that guidance is still changing every day, right? We look to the best science and the best, information that we have at the point in time to make the decisions that we have. And when I say we, I mean, from us here at UI Healthcare up to the CDC, right? And so I think, with those things, how should we double mask? Should we wear one mask? Should we wear no mask? Should we wear a face shield? Those things constantly changing and us having to shift. I don't see that ending anytime soon either. So we'll continually be challenged with that as well. Nick, how about you? Most rewarding and most challenging?
I am terrible at picking, and so I'm gonna have to say a couple here, so cut me off if you need to. So most rewarding has been for sure seeing the huge success stories come out of our unit. We had a coworker whose family member was in the unit, and everyone was so worried about everything with this patient, and we were like, we have to be on our A+++++ game with this, because he's technically one of our own. So it's to see that family member do well and leave the unit was the best thing to hear from the whole pandemic. And we've had a couple of different highlighted cases that have been great success stories, on the news, that have been awesome to watch them just kind of blossom. Another big, really cool success story is our new grads that have come in as nurses. I would never, ever, ever want to be a pandemic, start as a COVID nurse, ever. It's some of the sickest patients I have seen in my nursing career, and it is overwhelming. I cannot imagine starting my nursing career as a COVID-19 nurse. And our new grads that we've had through the last year have been absolutely outstanding. Stepped up to the plate, taking sick patients that they probably shouldn't be, and doing an amazing job. So, and then of course the vaccine, getting that, I remember December 18th was the glimmer of hope we needed. So the worst part definitely has been, I feel not being able to see my family, just because of the precautions that we don't know about, spreading and whatnot. So, they are all on the route of vaccine. I actually get to see my mom for the first time tomorrow. She's fully vaccinated. So I know, I'm super excited. So it's almost been 6 months since I've actually seen her face. So, and then definitely the seeing patients pass and knowing that you're going to be the last person that they see when they go on the ventilator. And that's definitely a downfall of that.
Mm-hmm.
The whole downside of the pandemic. It was hard. It's been hard. So
yeah. I'm going to brag about Nick a little bit. I had the honor of awarding him the Daisy Award, and the nomination that was written about him was about a patient that was alone at the end, and how Nick stayed in his full PPE gear for hours by that patient's side so that they weren't alone when they passed. And I think that, you know, Nick is like a lot of the other nurses that we have here at the University of Iowa that, you know, we not only heal people and keep people healthy, but we also help people die with dignity and respect, and to not be alone. So thank you, Nick. Yep. Seth, how about you?
I also have many highs and many lows. Yeah, my highs consist of getting to you know, see pictures that people send of our success stories. You know, they send pictures from home and they say, you know, look at me now, I'm doing good. I remember specifically one time, a time that really tickled me was when I was down in MRI helping out with monitoring of a patient, and as I walked out to go back to the MICU, I heard a voice behind me say, "Hey, what are you doing down here?" And I turned around and it was one of our patients, and that patient this patient was on the ECMO pump because they were so sick with COVID-19, and had a tracheotomy placed in their neck because, you know, they were on the ventilator for so long. But this patient was up, walking, had the tracheotomy revised, and was going himself down to safety and security to pick up his, you know, all of his, you know, wallet belongings, all of his things of value that were locked up, because he said, "I'm going home." And so that was awesome. It was one of the great ones, you know. And yeah, the lows have been pretty low. One of the lowest ones was I was charged one day, and we had a patient who was very sick for a long time and making some baby steps, was still extremely ill, was still ventilated, and was still on continuous renal replacement therapy or continuous dialysis. And out of the blue, went into a life-threatening cardiac rhythm, and then it was non-reversible. And so while the bedside nurse was in the room, turning up all medications and getting all of the, you know, blood pressure medicines maxed out to the extreme, even above what is recommended to try and have this patient last until the family would arrive, I was scrambling to get a Zoom call organized, and just, you know, bringing that into the room. And the patient had already expired, but, you know, obviously the family hadn't known that yet because we were all scrambling at the moment. Bedside nurse was there holding the patient's hand like she should, and, you know, just hearing their screams, it's pretty tough.
Mm-hmm. Yeah, I think, like you said, there's a lot of lows in this past year. And I think, you know, all four of us on here are seasoned ICU nurses and know what it's like to be with a dying patient. But I think that these were unprecedented times. And I think that it's even hard for really experienced ICU nurses. So heartfelt appreciation for you guys sharing your hearts today, and sharing your highs and sharing your lows, because not everybody can do that. So appreciate you for doing that. We're almost out of time. I just want to say there's a couple questions that we weren't able to get to. My apologies. There's also a lot of thanks here in the Q&A to you three for what you're out there doing every single day. So from myself and from the others who have you know, chimed in on our Q&A, thank you for everything that you have done and continue to do for our patients and for Iowans. For all of you out there that are listening, please continue to wear a mask. Please continue to social distance. It's incredibly important as we get more people vaccinated that we still take these precautions to keep others safe in our community. We're definitely not out of the woods yet. So I'm going to take this opportunity to kind of do one last run through. If you all want to say goodbye to the folks who have joined us today, and then we'll wrap up. Debbie?
No, just thank you for joining. I appreciate you taking the time to get to know more about our story. I think the news and social media is difficult sometimes, and we all have our own stories. So I appreciate you taking the time to listen to us today.
Nick?
Yeah, thanks everyone for listening. I also encourage anyone that knows anyone in healthcare to reach out to them, check on them, see how they're doing, make sure they're all feel appreciated and stuff. I sure do appreciate anybody that reaches out to me, and just to even just say, hey, thanks. So yeah, keep wearing your masks.
Seth, how about you?
Thank you to everyone for taking the time out and the 2 p.m. on a Thursday to listen to us. That is so much, so greatly appreciated. And yeah, please continue to wear your mask, wash your hands, social distance, get any vaccine that is available to you the moment it's available to you. The light at the end of the tunnel it's there, and it's getting brighter every day. Stay vigilant. We can get through this.
Thanks, Seth. Thanks, everybody. Be well.